Hello, friends. Welcome to the Aspen Daily Update from the Aspen Daily News. My name is Oliver Sharp. Very excited to be joined by two of the people on the front lines of the COVID-19 battle here in Pitkin County. Have Jordana Sabella, the interim public health director for Pitkin County, as well as Carly Sense, the COVID-19 testing and vaccine coordinator. Hello, ladies. Thank you so much for being here.
Thanks, Oliver.
Carly, I'd love to start with you. If you could tell me about the vaccination program that what happened this weekend. This clinic was set up very fast. Large number of people were able to be vaccinated. How did this all come together?
Oh man, it came together with quite a lot of teamwork across multiple areas within our community. Public health, Pitkin County Public Health certainly played a role, but was not alone in pulling it off. Big shout out to Aspen Valley Hospital and the IMT team. So we got notification last Thursday I guess 2 Thursdays ago now, about our allocation from the state. We received just around 975 vials of Pfizer vaccine, which is very exciting. It was up from 100 doses the week before. So you could imagine our excitement at being able to really kind of delve into what these mass vaccination clinics look like in the function and really take a big bite out of starting to vaccinate our most at-risk population, which for this week was our individuals who are 70 years and older. So very rapidly, the team put in the physical logistics, the site. That took place probably about over 5 days, which was really incredible. Again, a very big push from all the team members across the entire community. And between January 14th and January 15th, we actually accomplished vaccinating about 1,150 individuals across 2 days. Those individuals were pulled from our, we have 2 terms for it. We're switching over to the vaccine notification program. Otherwise, it was previously known as the pre-registration form. So directly from that list of individuals who had pre-registered with the Pitkin County Public Health in order to receive vaccination notification updates, we pulled almost 1,200 individuals from that list directly. They were able to schedule their appointments, and over the course of those 2 days, I think we averaged about 100 people per hour coming through the site, which was really, really impressive for our first go at it, so to speak. So it's a very exciting time.
Carly, that's such good news. It's such a positive announcement to have here. I'm so happy for those people that did get the vaccinations into their arms this weekend. And Jordana, can you talk about big picture, what this means for us as a community going forward? Carly mentioned a little bit that it was a very collaborative effort with all the different agencies coming together. Maybe touch on that a bit and what it's going to take for all of us to really continue to battle COVID-19 going forward.
Sure. I think I just want to take a minute here and make sure that we've the opportunity to thank all of the partners and volunteers who made that first mass clinic possible. In addition to the folks that Carly mentioned, the Aspen Ambulance District, Aspen Skiing Company, Aspen Valley Hospital, Aspen Fire Department, Carbondale Fire, City of Aspen Police Department, Community Health Services, Music Associates of Aspen, Pitkin County Sheriff, and the Snowmass Village Police Department all had huge roles in coming together to make that event so successful. And we've been just receiving positive feedback from the community about how friendly the staff were and how efficiently the clinic was run. So it is great to hear some positive feedback in our COVID-19 response. Going forward, things that we wanted to make sure that the community still is aware of is that even after you're vaccinated, it's going to take a little while for your body to build antibodies. And in that meantime, there are several reasons for continuing to follow the 5 commitments, wear a mask, and continue to distance. While you're waiting for your body to build those antibodies, as well as we're still waiting for further research to really determine if transmission of COVID is possible even after receiving that vaccination. So while we are very excited to know that the more folks that we do get vaccinated, the more this is going to help us in reducing transmission in our community, protecting those that are most vulnerable and on the front lines. we are still needing everyone at this point to continue to follow those 5 commitments to containment. Thanks, Oliver.
We have to stay aware for sure. The fight will continue, but it is very good news that we do have our first group of people vaccinated, second group actually after our healthcare workers and frontline workers. Carly, can you talk a little bit about what you know about vaccine allocation going forward? Have you heard anything from national authorities or state authorities about what we'll be receiving here locally? And who's the next group that's going to be able to be vaccinated?
Yeah, absolutely. So the allocation process is certainly a sort of trickle-down choice between the federal government, the state, and then local counties. So the state of Colorado is allocated a percentage of the entire vaccine allotment, so to speak, based on population. So what is the percent of the United States population that resides in Colorado full-time? So the federal government then divvies up the vaccines that are available between the 2 authorized use vaccines, which are the Moderna and the Pfizer. Those then get shipped to the states, and then the states do a very similar thing where they are looking, in Colorado at least, at what phase each county is working on and kind of what the entire state is working on. Right now for us, that is phase 1A and phase 1B above the dotted line, which is a little confusing and a misnomer. What that ultimately means is that we are focusing on healthcare workers and our frontline public safety workers. That falls under 1A. And then 1B above the line are lower risk healthcare workers and individuals who are 70 years and older. So right now, they take our percentage of that population, which fall within those phases, and then give us vaccine based on that percentage. It's a little complicated. There's a lot of math involved, but they are doing this in order to be as equitable as possible. So that way they're not giving vaccine to individuals who won't be able to utilize it right now. They're really focusing on the counties that need the vaccine ultimately the most in order to get through the current phase as quickly, as fairly, as equitably as possible. So that is sort of the process on how we're getting it. It's certainly been a slow ramp up. The first doses that we were allocated were before Christmas, and those went to Aspen Valley Hospital in order to take care of those higher risk healthcare workers. And so that has been a slow move. We knew that that was going to be the case. 2 weeks ago, we got 100 doses in order to start our 70 years and older population. As production increases across the country, we expect to see a growing number of vaccines be allocated to Pitkin County. Obviously, last week, receiving almost 1,200 doses was incredibly exciting. I don't think that we can expect that every week. I wish we could. But that being said, they are doing it in order to be as fair as possible. So hopefully in the coming weeks, we will see slow adjustments and slow increases as all the counties in Colorado move through their most at-risk populations. Looking forward, as soon as we're done with our 70 plus, we will be able to move on to those other essential workers, which we know encompass a vast majority of the community within Pitkin County. So we know everyone is anxiously waiting for sort of their turn in line, so to speak. But rest assured, we will get through this 70 years and older population as quickly, as fairly as possible, so that way we can move on into those next phases.
Excellent news. And Jordana, I know we moved into a red level restriction last week. Tough decision made across the board by, again, a lot of different agencies that are kind of in charge of making these decisions. Can you talk about where the numbers are here locally with regard to our incidence rate and what we'd like to see happen with those so we can possibly start loosening some restrictions down the road?
So we continue to monitor our incidence rate. We're currently the highest in the state, and it's been up as high as 3,000 per 100,000, and in recent days has been ticking down slowly. So we hope that continues to happen. What we have seen is that in other counties who've implemented the full red level restrictions, they have in a week or two begun to see that incidence rate come back down. So we are hoping to follow suit by having folks be able to follow all of the red level restrictions, which not only affects indoor dining being closed, but affects things like only being able to associate with your household. That household restriction also carries over into lodging. So if you're coming to stay in Pitkin County, whether it's a hotel room or a VRBO or a condo, you're limited to that one household gathering size. Additional capacity limits are put on different sectors in the community, and we are just really appreciative of everyone being able to do their part, to shrink their circles, to continue following the 5 commitments, wearing a mask, keeping your distance. If you do feel sick or any symptoms at all, please go get a test. And we are eagerly awaiting our numbers to be able to turn that incidence rate around, and then be able to increase capacity as we are able to.
Excellent. Well, certainly a long fight ahead, but it is very nice to finally be heading in the right directions with regard to vaccinations. Thanks to Jordana and Carly, both of you, for being here today, and for all of your teams in the efforts to battle COVID-19. We all certainly appreciate it here in Aspen.
Thank you.
No, thank you so much.
Thanks all of you for joining us on this Aspen Daily Update. You can find more at aspendailynews.com and across the social media networks. We'll see you tomorrow.